Hello, welcome to NextMeds. If you haven't subscribed to our channel, please hit the subscribe button for daily videos about health, nutrition, and disease-related videos. Cushing syndrome is a complex hormonal disorder characterized by prolonged exposure of the body's tissues to high levels of the hormone cortisol. Cortisol, often referred to as the stress hormone, plays a vital role in regulating various bodily functions, including metabolism, immune response, and stress response. This syndrome is named after Dr. Harvey Cushing, who first described it in the early 20th century. It can affect people of all ages, although it's more commonly diagnosed in adults aged 20 to 50. Common symptoms of Cushing syndrome include weight gain, particularly around the midsection and upper back, often referred to as a buffalo hump. Roundness or puffiness in the face, referred to as moon face. Fatigue and muscle weakness. High blood pressure. High blood sugar levels, which can lead to diabetes. Mood swings, irritability, or depression. Thinning of the skin and easy bruising. Irregular menstrual periods in women. Cushing syndrome can be caused by various factors, including excessive use of corticosteroid medications. Long-term use of corticosteroid medications, such as prednisone for conditions like asthma, rheumatoid arthritis, or lupus, can lead to Cushing syndrome. This is the most common cause of Cushing syndrome. Adrenal tumors. Tumors in the adrenal glands, which produce cortisol, can lead to excess cortisol production. These tumors can be benign or malignant. Pituitary tumors. A non-cancerous tumor in the pituitary gland, known as a pituitary adenoma, can cause the pituitary gland to produce too much adrenocorticotropic hormone, which stimulates the adrenal glands to produce cortisol. Ectopic ACTH syndrome. In rare cases, tumors outside the pituitary gland, such as in the lungs, pancreas, or thyroid gland, can produce ACTH, leading to excessive cortisol production. Familial Cushing syndrome. In some cases, there may be a genetic predisposition to developing certain types of tumors that can cause Cushing syndrome. Adrenal hyperplasia. This condition involves the enlargement of the adrenal glands, leading to excessive cortisol production. Iatrogenic Cushing syndrome. This refers to Cushing syndrome that develops as a result of medical treatments, such as high-dose steroid medications or injections. The pathogenesis of Cushing syndrome involves dysregulation of the hypothalamic-pituitary-adrenal axis, which controls the body's response to stress and regulates cortisol production. Here's an overview of the pathogenesis. Excessive cortisol production. The primary feature of Cushing syndrome is the overproduction of cortisol, a steroid hormone produced by the adrenal glands. This excess cortisol can result from various factors we discussed before. When cortisol levels rise, it inhibits the release of CRH from the hypothalamus and ACTH from the pituitary gland, thereby suppressing cortisol production. However, in Cushing syndrome, this regulatory feedback mechanism is disrupted due to the presence of tumors or prolonged exposure to exogenous corticosteroids. The diagnosis of Cushing syndrome typically involves a combination of medical history review, physical examination, and various tests to measure cortisol levels and identify the underlying cause. Here's an overview of the diagnostic process. Medical history and physical examination. The healthcare provider will review your medical history, including any medications you're taking, symptoms you're experiencing, and any known medical conditions. A physical examination may also be conducted to look for signs of Cushing syndrome, such as weight gain, round face, thin skin, and purple stretch marks. Blood and urine tests. Cortisol levels. Blood and/or urine tests may be performed to measure cortisol levels. This may involve collecting multiple samples over the course of a day to assess cortisol secretion patterns. ACTH levels. Blood tests may be conducted to measure levels of adrenocorticotropic hormone, which stimulates cortisol production. This can help differentiate between pituitary-dependent and adrenal-dependent causes of Cushing syndrome. Imaging studies. CT scan or MRI. Imaging tests such as computed tomography, CT, scans, or magnetic resonance imaging, MRI scans may be used to visualize the adrenal glands and pituitary gland. These can help identify tumors or other abnormalities that may be causing excess cortisol production. Dexamethasone suppression test. This test involves taking a dose of dexamethasone, a synthetic glucocorticoid, and then measuring cortisol levels to see how the body responds. Abnormal results can indicate Cushing syndrome. CRH stimulation test. In some cases, a corticotropin-releasing hormone, CRH stimulation test may be performed to help differentiate between pituitary-dependent and adrenal-dependent causes of Cushing syndrome. High-dose dexamethasone suppression test. In certain situations, a high-dose dexamethasone suppression test may be conducted to help distinguish between Cushing syndrome and other conditions that can cause elevated cortisol levels. The treatment for Cushing syndrome depends on the underlying cause. Here are some common treatment approaches. Gradual reduction of corticosteroid medications. If Cushing syndrome is caused by long-term use of corticosteroid medications such as prednisone, the dosage may be gradually reduced under medical supervision. In some cases, alternative medications with fewer side effects may be prescribed. Surgery. Surgical removal of tumors causing Cushing syndrome may be necessary. This may involve adrenalectomy. Surgical removal of one or both adrenal glands may be performed if the syndrome is caused by adrenal tumors. Transsphenoidal surgery. For pituitary adenomas causing excess ACTH production, transsphenoidal surgery may be performed to remove the tumor. This involves accessing the pituitary gland through the nose and removing the tumor without the need for an external incision. Tumor removal. If Cushing syndrome is caused by ectopic ACTH-producing tumors, surgery to remove the tumor may be recommended. Radiation therapy. In cases where surgery is not possible or unsuccessful, radiation therapy may be used to shrink or destroy pituitary tumors. Medications. Cortisol-lowering medications. Some medications, such as ketoconazole, metirapone, or mitotane, may be prescribed to lower cortisol levels in patients with Cushing syndrome. These medications work by inhibiting cortisol production or blocking its action. Pathology. Pathology is a medication that can suppress cortisol production by targeting the receptors responsible for ACTH secretion. Mifepristone. Mifepristone is a medication that blocks the action of cortisol at its receptor sites, providing relief from some of the symptoms of Cushing syndrome, particularly hyperglycemia. Symptomatic treatment. Other treatments may be prescribed to manage specific symptoms associated with Cushing syndrome. For example, hypertension medications. Antihypertensive medications may be prescribed to control high blood pressure. Blood sugar control. Medications or insulin therapy may be necessary to manage elevated blood sugar levels and prevent diabetes. Bone density medications. Medications to prevent osteoporosis may be prescribed to maintain bone density. Lifestyle modifications. Adopting a healthy lifestyle, including regular exercise, a balanced diet, and stress management techniques, can help improve overall health and well-being in individuals with Cushing syndrome. Thank you for watching NextMeds. Please like and subscribe for daily videos about health, nutrition, and diseases.